The most common reasons women see a urologist go all the way from stones onto cancers, but in this practice at least, I think we see mainly prolapse and leakage, recurrent urinary tract infections, probably the most common chief complaints we get. We all specialize in something a little bit different within the field of urology. My area of interest is a lot of the prolapse, which a lot of patients will see a urogynecologist for as well. I do a lot of the incontinence. I'm minimally invasive trained, so I do a lot of the robotic surgery as well. Incontinence affects about 50% of women over the age of 65, but we see it as young as in our teenage years, and 19, 20-year-olds, it just gets more prevalent the older that we get. It's because we don't really talk about it, but we are all leaking, and there are so many options out there, including doing nothing, but it would probably make you feel better just to hear that from someone that, okay, if you're okay with the leakage, you don't have to do anything, but if you're bothered, here is a gamut of options for you, and there are so many options that are worth at least keeping in mind for the future. There are several different types of incontinence. I guess the most common types are stress incontinence or urge incontinence, or really a combo of the two, which we call mixed incontinence. Stress incontinence is mainly leakage with coughing, sneezing, I'm doing a jumping jack, I'm leaking, exercise. Then we have patients with urge incontinence, which is mainly, I gotta go, I can't get to the bathroom in time. Then we get a patient that comes in and says, I'm just leaking. I have no idea when it happens. It's based on bother. Prolapse is quite common, and it really means that different organs are somewhat falling within the vagina, whether that's the bladder, the uterus, the rectum. There are many options for it. Most women will have some degree of prolapse. Most women are not bothered by the prolapse. Once they get to the point that they are bothered by it, then I think it's worth discussing options with us. So different options for therapy range from completely non-invasive, very low risk, to invasive, a little bit higher risk. But really, to figure out what's best for you and for your goals in particular, it's probably best that you speak with a specialist about it. The best things a doctor can do is somehow heal a patient and never see them again, not because we don't like them, but because they're fixed. And one of the most satisfying parts of doing a surgery for leakage, or at least stress incontinence, putting in a sling, is you have now fixed this patient, and usually you don't have to see them back beyond their regular post-op visits. Our main drive in our practice is that we are a female-centered urology practice, serving women, doing the best we can in the latest that we can as far as technology goes for female patients. It is nice to have three minds working on one patient. We work very well together. I really hope that people feel a little bit at ease that incontinence is common. Two, that you will maybe reach out to a provider, make you feel a little more comfortable to reach out to a physician about how you're feeling and different ways that we can help you. And if you ever needed to reach out, you'd always contact our office.